I'm now really pleased to introduce our first speaker of day 2 of Euromet. It's Dr. Alexandra Burton, and as I said, she will be talking on understanding the psychological and social impact of the COVID-19 pandemic on young adults. And she's going to be speaking specifically about a study that she's been working on. A little bit of background about Dr. Burton. So she's a senior research fellow in the Department of Behavioural Science and Health at University College London. And amongst other things, she's been working on studies that explore the impact of social isolation and social restriction measures on the mental health and well-being during the COVID-19 pandemic. If you've got any questions as Alexandra is speaking, please do type them into the Q&A box to the right of your screen, and it's the stage Q&A that we're looking for you to write your questions in there, and I will then put them to Alexandra at the end of the session. And if someone puts a question there that you really like and you want answered, you can upvote it. There's a little thumbs up button next to the question, so you can use that if you wish. Okay, I think that is more than enough from me, so over to you, Dr. Burton.
Okay, thank you so much, Melissa, for that introduction. Can I just check my slides?
Absolutely, perfect.
Perfect. Okay, so as Melissa said, I'm a researcher at University College London, and prior to the pandemic, my research predominantly explored the relationship between concepts such as social isolation, social support and loneliness on health outcomes. But since March 2020, a lot of our existing research was put on hold and the world changed around us. So I've been working on the COVID social study, which has been exploring the psychological and social impact of the pandemic. And I know the focus today is on young people, and that's been one element of the research that we've been doing. So I'm just going to introduce the study as a whole, and then move into some findings, particularly with young adults and young adolescents as well. So before I go on to talk about the COVID social study, I'm very aware that this is a European conference, and our study is based in the UK. We've also got something called the COVID Minds Network, which is an international network of researchers who are all working on global mental health during the pandemic. This work is led by Dr. Daisy Fancourt at UCL, and it brings together 140 longitudinal studies around the world to understand the impact of the pandemic on mental health. And we're really aiming to bring collaborators together to share findings, to share resources, to see what's happening in different countries and different cultures. And it's really a place where we're cataloguing and disseminating findings into global mental health. So if you're interested, the website is there. It's www.covidminds.org, and you can search that website specifically for studies into young people's mental health, and you can also search by country. So I did a quick look through to see where we were up to with the number of studies, and found that there is research going on in Denmark, in the Netherlands, in the UK and Ireland specifically, with young people. So please do have a look at that resource. You can sign up for newsletters, you can see publications that are coming out that might be of particular interest in your country or other countries around the world. So I think this is a pretty obvious question for many of us. You know, we've all been experiencing this together for the past 12 months. But I just wanted to start by thinking about some of the reasons why the pandemic might be affecting our mental health and well-being, and why it's important to study this aspect of health outcomes. So we've been conducting interviews with over 200 people from different groups, and we're finding patterns, particularly among vulnerable groups, that fear of the disease and becoming ill is obviously a huge concern, specifically for key workers, for people with long-term health conditions, and for older adults. We've also had people being worried about accessing essential services, so food, medication, as well as accessing health and social care services, particularly during lockdown and at the beginning of the pandemic. We've had people tell us that they are just feeling very uncertain at this time, and they just don't have control over their situation. And I think in the UK, things are looking a little bit more positive with the vaccine rollout, but there is still this sense of uncertainty around variants and around whether this is effective. So we're continuing still, even though the lockdown is lifting in the UK, to have this feeling of what happens next, really. But I think time and time again, the huge change to our social lives, our reduced social contacts, just feeling lonely and socially isolated, and changes in how we're socializing has come up time and time again in our interviews. And this is particularly affecting young people, more so, I think, than the other items on the list there. So this is the thing that young people are really telling us has impacted their mental health during this time. So why is it important to think about the social sort of consequences of the pandemic? So there's a lot of convincing evidence that existed before the pandemic, that this has been an area of study for a number of years, that loneliness impacts our health. Loneliness is bad for our health. And not only our mental health, so loneliness is associated with increased risk of depression, anxiety, and suicidal thoughts, but it's also associated with increased risk of physical health problems. So there have been studies to show that people who are lonely are at an increased risk of cardiovascular disease, that they're more likely to have cognitive decline and dementia in older age, and also that people who are lonely are more likely to die from these conditions than those who report not being lonely. So I guess the implications for our health are huge, potentially, thinking about how we've experienced this pandemic and how we experience it going forward. And I just wanted to have a think about why loneliness might impact our health. So theories suggest that social support has a number of pathways, and that these pathways are modifiable. So if we have access to positive social networks, we have people around us, we experience social support, we find that this can promote our engagement in health behaviours. So for example, if we've got a friend, we're more likely to possibly go for a run together. If you live with a partner who smokes and he decides or she decides to quit smoking, you probably would do that together. If you were both smoking together, it would be easier to do that. And having positive relationships also directly influences our feelings of positive psychological well-being. So it makes us feel good about ourselves. And that in turn influences our motivation to participate in health behaviours, which of course are good for our health. And then both taking part in health behaviours and experiencing positive well-being impact our ability to manage stress through biological processes. So we find in studies that people have improved immune function, reduced inflammation, and a reduction in the stress hormone cortisol. And again, this can in turn lead to improved health outcomes. So on the flip side, if we're feeling lonely, if we have negative relationships, then the opposite can happen. So we may be less likely to participate in health behaviours, and we may have poorer mental health. And again, this would impact our biology. We might have higher levels of inflammation and impaired immune regulation, which in turn are associated with chronic stress, with cardiovascular risk factors and depression. So that's just a bit of background to why social isolation and loneliness are important for our health, or negative for our health. And it sort of sets the scene for why this pandemic is particularly concerning. So I've been taking part in the COVID-19 social study, and that's comprised of two separate but related projects. So first of all, we've been conducting a longitudinal survey. So we've been understanding people's experiences over time, asking people to complete questionnaires over weekly, and then following, I think from January onwards, we went down to monthly. And we've been learning about how people are feeling, how they're responding to the restrictions, and what difficulties they're facing. And we're gathering information on everything from whether people are getting enough sleep, their risks of loneliness, depression, and anxiety. So through studying these 70,000 people, we found that someone's experience of the crisis is largely dependent on their life situation during lockdown, prior to lockdown, sorry. So we found that people from ethnic minorities, those who are financially vulnerable, those who come from lower socioeconomic backgrounds, and young people are struggling much more than those with greater social privilege. And we've also been conducting in-depth qualitative interviews, which have helped us to gather a richer understanding of why the pandemic is affecting people's mental health. And that's really helped us to hear people's voices, to tell us their unique stories about how they've experienced the pandemic, and for us as researchers to use participants' words in our write-up and give a bit more power to the statistics. And we've been recruiting people through a range of mediums, so social media, third sector services, research organisations, and kind of bigger organisations in the UK that have been reaching out to people from more vulnerable backgrounds. So thinking now specifically about young people's mental health this time. So there's been a lot of interest in the media, and I think third sector organisations who are working with young people have been really trying to shout loudly about how the pandemic has been impacting young people's mental health. So I guess when we think about the more clinical and severe end of the scale, there have been reports in the UK of initial drop in referrals to child and adolescent mental health services during the first lockdown. And findings from England's Mental Health of Children and Young People survey found that 44% of young people with probable mental health problems didn't actually seek formal help because of the pandemic. They were worried about accessing services, or they were unable to access services. But since the easing of the first lockdown as well, the Royal College of Psychiatrists here in England have reported that 80,000 more under 18s were referred to the NHS mental health services up to December 2020 than in the same period in 2019. And the number of children and young people needing emergency care rose by 20%. So 18,000 people more young people were accessing emergency care for their mental health. So there are concerns that this lack of support during the pandemic is masking the scale of the problem and will result in a continued increased demand for under-resourced services. And researchers had to move very fast during this time to sort of study in real time an ever-changing situation. So while there are some emerging studies, there's still limited empirical research exploring the scale of mental health problems in young people, and giving young people the opportunity to tell us in their own words how they've been feeling. So just to sort of reiterate the reason and the aims of the research. So we've set out 2020 to explore how social isolation, social distancing measures and the pandemic has impacted mental health, wellbeing and social behaviours. And we've done interviews with adolescents, and the survey was with 18-year-old and above. And we're also interested in what the protective factors have been and if people have used coping strategies during this time to support positive mental health. So I just want to start by showing you some graphs from our survey, which have been comparing age groups. So this is a graph around anxiety scores. So since the start of the first UK lockdown, we've continued to collect data that demonstrates the discrepancies that young people aged 18 to 29 face in mental health and wellbeing. And we have around 7,000 young people in our survey. And young people being aged 18 to 29. So if we look at graph B in the top right hand corner, you can see the sort of aquamarine line is the people aged 18 to 29 years in the survey. And you can see that their levels of anxiety have been significantly higher than all other age groups. And this shows the first 20 weeks of lockdown, so from March to around June, July time. And we've seen a gradual improvement as lockdowns have been eased, but I think it's important to say that this group is still reporting much higher rates of anxiety than other age groups. And we also see a similar pattern for depression. So again, if you look at the graph in the top right-hand corner, graph B, so young people's levels of depression have also been significantly higher than all other age groups. And again, this shows the first 20 weeks of lockdown. So there was gradual improvement, but it's important to know that currently, so we don't have the fully analysed data, but we are still seeing patterns that this age group are reporting much higher depressive symptoms than other age groups. So these graphs are a little bit more less refined, I guess, but this is the kind of pattern across time from March 2020 to March 2021. And this is looking at loneliness by age groups and happiness by age groups. So in particular, young adults' loneliness levels increased with the onset of the pandemic, and then again during the January lockdown this year. So I think the research previous to the pandemic suggests that young people were already more likely than older people to feel lonely, and this risk has increased in the early months of each lockdown. And students especially were more at risk of loneliness than before the lockdown. So I think around 6 weeks before lockdown ended, we saw that loneliness levels didn't really improve, and it was only by mid-May did we begin to see a slight decline in feelings of loneliness. And again, this age group continues to be the most lonely compared with the older age groups. And we can see a spike in January 2021, which in the UK was when we were in our third lockdown. And we also see that young people are reporting the lowest levels of happiness, particularly at the start of each lockdown. And again, while this improves through time, it still shows that this age group are the least happy compared to other age groups. And the final slide I wanted to show on the survey data was around the confidence in the UK government. So our research suggests that confidence in the government is the most significant predictor of compliance with social distancing restrictions and lockdown restrictions. And young people seem to be less confident in the government than other age groups. They also have a decreasing level of well-being, so they may be more likely to ignore COVID-19 guidelines to try and protect their mental health. If they're feeling lonely, they might want to go and see a friend, or they might need to reach out to somebody. And also, if they're not feeling confident in the government, then this might increase their risk of those behaviours. So I think the key message there is helping young people manage their mental health may be important both for well-being, but also for disease control overall. So moving on to the qualitative research that we've been conducting. So we have spoken to 37 young people aged 13 to 24, and we've been conducting in-depth interviews remotely, so over video call and over the telephone. And we've asked people how the pandemic has impacted their mental health, their social lives, what their worries are for the future, and what their priorities might be as well. And also importantly, we've asked people if they've used any coping strategies or any protective activities have helped them during this time. And as we can see, most of the sample were still at school or at university, and we sort of had a 50-50 split between adolescents and young adults. So not surprisingly, I think, given the focus of my talk is on loneliness and social isolation, we did find young people were missing social contact during lockdown. They also talked a lot about the impact of disrupted education and not being at school, and the associated uncertainty around exams and assessments being cancelled. Some people talked about changes to relationships, both with family and friends. But there were some people that actually said their well-being had improved during the lockdown. And I think one of the most powerful things was that they described an increased awareness of mental health among their family and their peers, and they were able to talk about mental health more openly than they ever had done before. So I'm just going to present some quotations from participants to sort of highlight and bring to life some of these themes. So in terms of missing social contact during lockdown, so many participants reported a decline in well-being due to feeling lonely and isolated, being unable to see friends or family, and feeling that they were really missing out on important life events was a source of sadness and frustration. So I think the first quote in the top right-hand corner shows somebody who, as I mentioned before with the confidence in government slide, this shows potential problems with breaking social distancing restrictions in order to protect well-being. So this female aged 13 to 17 says, as soon as restrictions were relaxed enough that you could meet someone socially distanced, I was down at my friends' houses that are 100 metres down the road 3 or 4 times a week just to get out of my house. I got so frustrated being cooped up. And the second quote really highlights somebody who is missing physical contact, and Zoom isn't a substitute for that contact. And this person talks about still feeling lonely, even though they're back at school, not able to have that physical contact, which she was looking forward to if the pandemic gets better. And I think for some participants, Zoom was quite counterproductive in maintaining social networks and social relationships. For some people, they withdrew even further from those relationships. So this quote here from a male aged 13 to 17, he says he'd never heard of Zoom before. He was suddenly forced to do it and it was just too much. I've stopped talking to people. So you can see people may have become more withdrawn during the pandemic. So the second theme around disruption to education. So the cancellation of assessments and closures of schools and universities was a real source of loss, of concern and uncertainty for most participants. So a number of people talked about how difficult it was to learn remotely, to have suddenly to be doing lessons in your bedroom. And this was particularly for young people who were living in houses with a number of family members or small houses, not having the environment that was conducive to learning. And this male who was at university says that it just changed the nature of being able to learn productively. And as well as the change to remote learning, a lot of people said it actually gave them an increased workload. So I guess because they didn't have the structure and they weren't speaking to peers about the learning, they were more worried about the amount of work that they were having to do rather than the actual exams themselves. Another sub-theme was around education experiences and expectations. So I think a lot of young people were really worried about the cancellation of their exams and how that would look for future employees and for future universities. And a number of people said they felt that they were sort of having a get out of my exams and have sort of a relaxed time of not having to be graded. And they really worried about the perception that would have in the working world. And this person says they were really upset that they couldn't sit their exams. It was an anticlimax. They wanted to sort of prove that they'd done all of the work and all of their education had built up to this. And I think worryingly as well, and I think at the beginning of the first lockdown, it was obviously very confusing for a lot of people, including teachers and education providers. But I think there was sometimes a lack of support and communication from education providers, which then impacted mental health further and led to worse mental health. So this female, aged 13 to 17, says the school hasn't been great in terms of providing help. The attitude is it's okay not to be okay, but we're not going to do anything about it. So there was this sense of sort of feeling a little bit abandoned by school, especially at the beginning of the pandemic. And I think that did get better as time went on. So the third theme around changes to relationships. So participants spoke of stress, of anxiety, of anger regarding family and friendship tensions during the pandemic. For some people, this was due to not being able to spend time with their friends, which led to relationship breakdowns. However, for others, they were happy to adapt to maintain social connections. So one person said that he'd started playing games and met people through that online. And he was talking to people and meeting new people and having fun. And that was a complete distraction from what was happening. But in terms of the relationship tensions, this was an example of somebody who just didn't get on with their family. He says we would be in each other's faces a hell of a lot, and that got very difficult at times. I say it gets worse when we have to spend more time together. And similarly, this female teenager had an argument with her friend because her friend wanted to break the social distancing rules, and she didn't want to. And I think there was some of peer pressure as well that led to people worrying and feeling anxious. Despite relationship tensions, some participants also described feeling closer with their family. So this female says that she thinks that they're interaction. They managed to spend good time together and more time together. So again, it was a mixed picture depending on people's situation. I think interestingly, a number of people talked about how they might feel after lockdown. So changes in feelings about socialising. So about half of our participants described how their feelings about in-person social interactions had changed. Some felt more vigilant about being around other people, of the risks associated with future virus transmission. And adolescents in particular said they felt apprehensive about future social situations from not having been exposed to real life for a number of months and becoming accustomed to life in lockdown. So there were some feelings of social anxiety and a return to face-to-face interaction among participants. So this is just some examples of people telling us that they were feeling cautious about other people. You don't know who some of these people are. You don't know where they've been. You don't know, being quite close to you physically, how you're going to feel about that. And similarly, this person said they'd lost the ability to form coherent sentence. I think a lot of us can empathise with that. And she says, I know that sounds really stupid. It's just been really hard. So moving on to sort of coping and improved well-being. So we did have some positive accounts from our participants. So for those who described busy and stressful lives prior to the pandemic, social distancing restrictions provided a chance to pause, reflect, and for some people this had resultant mental health benefits. So this adolescent female says before lockdown, her sleep was all over the place. She was stressed with school, but lockdown has given her a chance to focus and make herself a lot better in terms of positive emotions. I think another big thing which I mentioned at the beginning in the overall themes was around increased awareness of mental health among family members and peers. So this participant says it opened up really big conversations within our family. I don't think they've ever had conversations like that before. Those are two really big positives for me, both myself and opening that up wider. It was conversations we'd never had. And while I mentioned previously that schools were sometimes not supportive and some participants didn't feel able to access mental health support, others did experience positive interactions with their university or with their schools. So both in terms of practical support, so extending deadlines for work, and just having someone checking in on you regularly, it just really helped this person feel like somebody was looking out for them. And again, this adolescent says that their teacher actually helped them and their friends think about proactive activities to do during lockdown to protect their well-being. So I think the really key thing from this was this sort of enhanced and increased public and peer awareness of mental health self-management during lockdown. And the final theme was just around physical protective activities. So as well as connecting with others and talking to peers, family and teachers about mental health, young people also described engaging in protective activities for positive well-being. So physical activity was a big one, doing exercises that helped people feel better, listening and playing music, learning new skills, engaging with hobbies, art, drawing, painting, sewing, being creative, and the importance of routine, and in the face of not having any routine, developing new ones. And this adolescent compared his sort of new routine with his friends who hadn't managed to establish new routines, and he felt that his mental health was much better, and that his sleep was also good as well because of that. So just coming to the end, so I just wanted to think about some of the practical implications of all that data. There's a lot of information there, there's a lot of data there, but I think, you know, one of the things that's really come out about this is that we need to create environments for young people to feel safe when talking about their mental health. It feels like it's had a really positive impact, people being able to share proactive activities and talk about when they're feeling particularly depressed or anxious. So I think that's both in terms of creating an atmosphere as well as confidential spaces for people to go and talk to each other. And that could be around schools, in colleges, in universities and workplace. And also maybe training staff who work in education to identify signs of deterioration in mental health, both when people are expressing concerns, but also if their behaviour changes or if they seem to be withdrawing from their work. I think also finding ways to engage with somebody's wider social networks and mapping out their support networks might be helpful. So having conversations with families, with third sector services, with peers, so that there's more of a network around people when they are struggling. Again, this encouragement and promotion of positive activities, giving people the space and the time to engage in new hobbies or learn new skills. And when people don't have access to the internet or to online activities, what can we do to support those people? We need to think about creative solutions for protective activities. And I think, as you've seen, that young people all have very different experiences, so not one size fits all. So we need a tailored response depending on people's circumstances. We shouldn't ignore the fact that some young people are experiencing improved well-being during this time. And we need to think about how we support them when things start to return to normal, because for those who are potentially socially anxious, this could be quite a difficult time as we come out of lockdown. So just some closing thoughts. I think if lockdowns and social isolation continue to be the main strategy for disease control, we need to take into account that young people face more loneliness, they're more depressed and more anxious than other age groups. They seem to be less happy and less satisfied with their lives. They're facing ongoing disruptions to education. They have worries about the future work world and going to university, and these concerns around returning to face-to-face socialising. And I think young people need ways to interact or gain mental health support, even if they do so online or in socially distant environments. So they need support, stability and understanding. And I think, just to add, we haven't finished the study and we really would like to conduct further interviews with other groups. So I think if there are any service providers or people working with particular vulnerable groups and you would be interested in supporting us to sort of get the message out for the study, we'd be really happy to work with people and have a chat about the study further. So these are some of the groups that we want to speak to going forward, particularly young carers, people experiencing financial difficulties, people who are homeless or use alcohol and drugs. So more kind of vulnerable groups, and also people who provide their services to any of the above groups. So just for the funders, so the Nuffield Foundation and Welcome, and this is the team, and we also have our study websites and Twitter feed at the bottom. And I don't know whether the slides will be shared, but these are some of the references from the talk that I've gone through, particularly around loneliness. And we have 2 publications there from the study itself, if you're interested in reading more. So that's it. Thank you.
Thank you so much, Alexandra. That was fascinating. We've got a few minutes for questions, so we've had a few comments and questions through. So if you're all right to sort of stick around till say 20 past, we'll try and get through some of those if that's okay. The first one is a comment. So great to hear from Dr. Burton. I've been taking part in the COVID-19 study for the last year, so really interesting to see some of the results coming out of it firsthand. So it's great. And now I've got a question, Alexandra. So fascinating to hear about the impacts of loneliness on the physical body. What is the most surprising finding so far, in your opinion, about how people are finding lockdown and coping with its impacts?
Surprising finding. I'm not sure it's surprising, but I think I kept mentioning it in my talk. I think this feeling that it's okay to talk about mental health. I think working in mental health, you feel like that's a message there, and that people do feel okay to talk about it. It's not stigmatizing anymore, and it's not something that people shy away from, but it really still is. And I think just that sense from the young people we spoke to, that suddenly it raised awareness and they felt more comfortable, and they were having conversations with parents and even grandparents about something they would have shied away from before and they didn't feel comfortable, I think is a really positive impact of the pandemic. I mean, it's difficult to say positive impact, but it just feels like the conversation has been opened up, and that in itself helps with loneliness feelings. If you can talk and share and tell people how you're feeling, then you can explore solutions. So I think that's been perhaps surprising with my mental health research hat on, that it feels this is something that people still struggle with, but they've had more opportunities to talk about.
Yeah, sure, absolutely. A question here from a colleague who's listening in from Finland. Do you think that there is a difference here between cultures? And he says, as I come from Finland, where social and physical distance is maybe more acceptable and common than in some other cultures.
Absolutely. I think, gosh, I think we can look at this on a number of levels, and we're finding, for example, you know, the different responses that governments have been implementing in different countries. You know, I'm aware in Sweden they really haven't had many lockdowns, and there is, from government level down, I think the governments reflect the people in a way, and they reflect how they think that their populations will behave. So I think that really filters down. So yes, I think there are differences in terms of how loneliness is experienced. I'm not sure I'm not aware of any comparative research that looks at differences in loneliness in populations, but it would be a really fascinating thing to explore and look at, cultural differences and how people actually experience social isolation and loneliness.
And I've been asking this to a number of our speakers during the conference, really, but just to sort of wrap up, what's your sense of kind of moving forward, and as we hopefully come out, well, we're starting to come out of the pandemic, hopefully, but in terms of, you know, what we've learned about sort of coping mechanisms, you talked about, you know, opening up kind of intergenerational discussions and things. I mean, are there things that positive things that will carry on post-pandemic? Young people's sort of coping mechanisms with mental health?
Yeah, I really hope so. I think, like I say, I think those conversations are key. I think the other issue is around service provision, particularly formal service provision, and the more we show that this is becoming a bigger problem for people, like I said in one of the slides, so many more emergency referrals for mental health, so many more people trying to access services after that delay, and I know that goes across all healthcare in the UK at the moment, but I just hope it brings to attention the need to resource mental health support further, you know, and I guess also just to listen to young people and find out what it is that helps them, what protects their mental health, rather than just doing to them, you know, this is how we would treat your mental health, what things would actually be useful and helpful, and what do you need going forward. I really hope it creates a dialogue and a conversation between young people, policymakers, so we can co-produce solutions going forward.
Absolutely. Thank you so much. And I think that leads us nicely to the workshops that are coming up in just over 10 minutes, because we're going to be looking at some of those specific kind of programs that have been put in place to support young people. So for anyone listening, please do join the workshops in 10 minutes or so. Just to finish off, Alexandra, some comments in the chat. Thank you for a very interesting seminar. I've gained a better insight into how the pandemic has affected the younger generation and how lonely they can also become without access to their peers. Thank you. Someone's saying fascinating. Thank you, Alexandra. So the link to the COVID Minds website is in the chat if anyone wants to take a look at that. And obviously, Alexandra did put details on the slides. We can share the slides as well if anyone's interested, with your permission, Alexandra. So thank you for that. Okay, wonderful. Thank you so much for your time. Really appreciate it. For everyone else, we've got 12 minutes before the workshop starts. So they're going to start at 10:30 promptly, so just over 10 minutes. If you go to the left-hand side of your screen where it says sessions, in about 5 minutes time that will become live. You click on that, you will see the 6 or so sessions that we've got running concurrently. Click on the one you want, you'll go into the session, and I hope you enjoy that. Excellent. All right, thank you everyone. Enjoy the rest of your day.
Thank you. Enjoy your day.